everyone. My name is Amadou Fofana, and for my facility, I'll be presenting the Richard Ward MD Sports Performance Center located here in Conway, South Carolina. To begin this presentation, I'll show you a short video featuring functions and features of the Richard Ward Sports Performance Center.
We're currently standing in the Ward Sports Performance Center, and this is where we take care of our student athletes when they're hurt. So one of the things that's unique about our Sports Performance Center is some of the equipment that we have that is different than what you'll find in traditional athletic training facilities. What we have Ron Trapp's working on right now is what we call our functional leg press that's put out by Monitored Rehab Systems. One of the advantages of this immediately is the instant feedback that the student athlete gets from the different games and activities that we utilize. We can control obviously the amount of weight that they're using. We can control how fast they have to move back and forth, and we can make the games easier or harder as we need to as we progress through their rehabilitation process. You'll notice with this game, one of the things that we can do is we can force the student athlete to work isometrically at different points in the range of motion of the knee. And we can set where they're doing this for as little as 15. Get a large
This machine
variety
is a
of resistance.
Kaiser functional
You can
training
also
machine.
adjust the arm up high, down low, so you can change the direction of pull. But you can do functional activities that simulate what they do on the field or on the court or on the track with resistance. So what Ron's going to do here is he's going to jump out with resistance pulling him back, and it's going to be forcing him to balance the whole time and control his body motion while the resistance
The
is
machine
acting
resists
against him.
the athlete as he works on motions
So it's a little bit more advanced
they would
than
normally
just simply
do
doing
in their field of
jumping
work.
or lateral activities, because now we have resistance pulling back. And as he progresses and does well, then we can just increase the resistance to force him to work harder, very simply. So this piece of equipment is a Woodway Curve treadmill. It's unique
This
in that
Woodway
it has the
machine
curve
allows
shape.
athletes
The curve shape is more
slowly
biomechanically
progress
correct for the
running
stride
before they
when
are
they're
allowed
walking
to
and
run on the
running.
field
The other
in
unique
full
piece about this
participation.
treadmill is that it is not motorized, so everything is self-propelled. So the student athlete is forced to actively work harder in extending their hip and driving forward when they're walking and running, so it simulates more realistically what it's like running outside on the track or on the court. So now we're in our hydrotherapy area, and this is our HydroWorks InstaFit therapy pool. Obviously,
feature
the
of
unique
the
thing about the
facility
therapy pool is that it has a treadmill
contains
in
an
it.
underwater
The treadmill
treadmill
can go as low as
and functional
0.1
camera
miles an hour,
to
all the
progress
way up to
athletes
7.5
to
miles
monitor
an
them.
hour. So the advantage of aquatherapy is that you can put a student athlete in here weeks and even months before you can safely have them running on a treadmill, on the court, or on the track. If they're post-surgical, as long as the wound is healed, then you can have them in the water and have them working. So typically with Ron, where he's at right now, the water level is we're reducing his body weight and the forces on his knee about 75%. So it's a tremendous advantage to be able to get in here and be able to walk.
The Richard Ward Sports Performance Center was built in 2011 and named in honor of long-term team physician Richard Ward, who gave countless hours of his time to the athletes at Coastal Carolina University since 1981. This state-of-the-art facility is located inside of Burke Stadiums, and it has more than 4,000 square feet of space and 600 square feet of rehab space. The facility also contains 6 taping stations to tape athletes for practice, to tape injuries. It has 12 treatment tables to treat athletes who are recovering or need to be stretched or rehabbed, a physician exam room to examine athletes, and offices for athletic staff, It is a private facility used by more than 425 student athletes at Coastal Carolina, and it is used by athletes participating in 18 different intercollegiate athletic programs, such as soccer, football, basketball, baseball, track. Every sport uses this facility. The primary use of this facility is commonly used by athletes or athletic trainers for functions such as rehab, hydrotherapy, pre practice taping, post practice recovery, and stretching. The purpose of the facility is to treat student athletes who have been injured or to prevent injuries to student athletes to make them more functional during the season and during their normal long hard days. This state of the art facility has many unique features, such as the HydroWorks polar and thermal pools, where athletes use to recover after practice or long days, or to heal bruises or injuries. Another feature is the hydrotherapy pool, which has an underwater treadmill and camera. This is made for athletes who normally can't run on the field, track, or court and work on this machine to progress their injuries. It also it also contains many Kaiser functional trainers, as you saw in the video, and Woodway curl treadmill. More unique features are the monitor rehab system functional leg press, also shown in the video, and many cardiovascular equipment to check athletes' hearts and stress rates. Most of the funding for this facility comes through the success of athletics or through donations or funding made through the Chanticleer Athletic Foundation. Some sustainability features included in this facility are no eating or drinking in the facility, and there are many recyclable materials such as cup, trash cans, and other materials. Here's my references, and thank you.